Hello everyone. So today we are going to see the scalp, which is a frequently asked question in the university. So these are my notes, which you can easily remember this by the pointer voice technique. And so the scalp is it is a soft tissue covering which protect the skull, which is made up of 5 layers. Remember from the word scalp, from S it is skin, C connective tissue or superficial fascia, from A aponeurotic, L loose areolar tissue and pericranium. Then write about the extent of scalp anteriorly, posteriorly and from each side. So anteriorly from the supraorbital margin, external occipital protuberance, superior nuchal lines, and from the east side superior temporal lines, which has shown in the figure, and you can also draw the figures also. Then the next important topic is arterial and nerve supply. So arteries there are in front of ear 3 and behind the ear are 2. So in front of the ear are supratrochlear artery, supraorbital artery and superficial temporal artery, and behind the ear are posterior auricular artery and occipital artery. Then comes the nerve supply. In front of the auricle and behind the auricle there are 5. 4 are sensory and 1 is motor. So in front of the auricle is supraorbital, supratrochlear nerve, zygomaticotemporal nerve, temporal branch of facial nerve and auriculotemporal nerve. And behind the auricle are posterior auricle nerve, lesser occipital nerve, greater occipital, third occipital and greater auricular nerve. Next comes the blood supply, which is separate 3-mark question in the university. So there are a supratrochlear and supraorbital vein which joins to each other and form the angular or facial vein. Then superficial temporal vein and posterior auricular vein. Then lastly, don't forget to write about the clinical anatomy. So the area of loose areolar tissue is also known as dangerous area of scalp because the emissary vein which passes through here, which can cause the infection. Next is black eye due to the accumulation of blood and fluid in a layer of loose areolar tissue can blow on the head track freely under the scalp, which is produce generalized swelling over the bone of the skull. Just remember the points and draw the diagrams for the effective answer.